Good morning to everyone joining us on the Zoom platform, and welcome to the Food and Nutrition Fan Project webinar on school nutrition in St. Vincent and the Grenadines. My name is Wendy Michael, and I am the representative for the Food and Nutrition Fan Project in St. Vincent and the Grenadines. My role in the Fan Project has included following up an ethics approval for studies on the SACEN in St. Vincent and the Grenadines, and providing input on project activities to enable smooth project implementation. The FAN project has as its aim to improve the quality and diversity of diets in its 3 study countries, namely Jamaica, St Kitts Nevis, and St. Vincent and the Grenadines, by engaging stakeholders to design, implement, and evaluate integrated packages of intervention that addresses key leverage points within their food systems. One of such intervention is the Women's Farmers Academy in collaboration with Helen's Daughters that is presently being undertaken in St. Vincent and the Grenadines and will run up to the 7th of December. 18 women farmers are being trained in areas such as sustainable agriculture, financial literacy, food safety, among other areas. We also had a grocery grab competition, which saw one main winner receiving US $150 and 4 consolation winners receiving US $135. The main winner was involved in a shopping spree. The main winner was involved in a shopping spree with a nutritionist who pointed out healthy food choices. Snippets of the shopping spree can be found on the Food for Change Caribbean Facebook site. So if you type food and the number 4 and the words change Caribbean, you would be able to see that shopping spree. At this time, I would like to give an overview of the purpose of the webinar. In 2018, the International Development Research Center, IDRC, funded the Food and Nutrition Fan Project with the overarching goal of improving dietary patterns and dietary diversity among CARICOM population to reduce the burden of diet-related non-communicable diseases in the region. The project is led by the University of the West Indies and undertaken in 3 CARICOM countries, Jamaica, St. Vincent and the Grenadines, and St. Kitts Nevis. The Fan Country Team Update and Revitalization webinar series plans to strengthen coordination between the FAN project, its St. Vincent and the Grenadines team, and project work in country in order to enhance the sustainability of country intervention. At this time, I would like to introduce the technical team for today's webinar. Catherine Brown is listed as host on the screen and will control the slides. Ashley Foster Eswick and Alana White as co-hosts will track persons with raised hands and unmute them to speak during discussion segments and read aloud some questions, comments from the Q&A. I will now invite Catherine Brown to take over to discuss the poll.
Good morning, everyone. Thank you for joining us this morning. And I see that 11 of 12 of you have answered the poll. So if there's one more of you to answer, I give you a couple seconds to answer it now. They're just 2 short questions. Okay, I'm going to go ahead and end the poll now just to give an idea on who we have with us today. So we'll see that 82% of us on the call were from government in St. Vincent the Grenadines and 27% from other areas. And what are we hoping to get out of the webinar today? Most of us want to improve knowledge and issues about food and nutrition security in St. Vincent and the Grenadines. Then 36% of us want to learn more about the project, and the remainder want to network with peers and engage in civic duties. So thank you all for taking the short poll. Good to know what we have going on, and I hope you enjoy the rest of the webinar. So over to you again, Wendy.
Thank you, Ms. Brown. Now, I'd like to say that there are 2 5-minute presentations. I would like now to introduce the speakers in today's webinar. Professor Alafia Samuels, dubbed by the Lancet as the fast food watchdog of the Caribbean, is the lead of the Food and Nutrition Project. She is a former director of the George Allen Chronic Research Center and is now an honorary professor at the Caribbean Institute for Health Research, University of the West Indies. Professor Fitzroy Henry has served 18 years as a director of the Caribbean Food and Nutrition Institute, a specialized center of the Pan American Health Organization, and is a professor of public health nutrition in the College of Health Sciences and the School of Public Health and Health Technology, University of Technology, Jamaica. I want to welcome Professor Alafia Samuels to begin her presentation.
Thanks, everybody. Good morning again. So we really are very, very pleased that St Vincent and the Grenadines is in the spotlight today. We're having our second webinar with you. And as you know, our project is coming to an end in another 6 months or so. So in the new year, we will also be getting back to you with a couple more webinars to update you. So today we just wanted to talk about the education sector, so to speak, that piece of the intervention that we have been doing, and to bring you up to date. So as a background, I think you all know that the Caribbean has the highest death and disease rates from non-communicable diseases in the region of the Americas. And the important issue about that really is that so many of these deaths are premature deaths. So whereas in Canada and the USA, people die of heart attack and stroke in their 70s and 80s, in the Caribbean, we are dying of heart attack and stroke in our 40s and 50s. When we are in the workforce, and of course, the burden on the family and the premature loss of life, the cost of disease and all that kind of thing. So really preventing chronic diseases is a priority in the Caribbean. And just to say that specifically looking at the children, among 13 to 15-year-olds in the region, the obesity rate ranges from 4% to 24%. Alcohol use, this is among children, we're talking alcohol use, 40% in 11 of the 20 CARICOM countries. Tobacco use, similar rates to adult uses, and less than 40% getting enough physical activity. So you know that we have a big problem. This is just a graphic from Healthy Caribbean Coalition's campaign that they ran recently, where they're talking to children about saying, you know, too much junk food is bad. Thanks to Fitzroy Henry for this slide. What can we do to target childhood obesity? So there's the issue of the school feeding program. We were supposed to do some work with that, but COVID, that, you know, school feeding and school vending, that puts up, that's a problem with the COVID. But when it comes down to number 4, classroom education, I'm going to be talking about that now in a second. And then the community education and public education, we will also talk about. So as you know, the FAN project's aim is to improve the quality and dietary diversity of the diet of the people in the Caribbean, so that we, as they say, we eat a rainbow of foods. Your plate should have every color in there, and you can only get some colors, some fruits and vegetables. So, you know, you have to get to the fruits and vegetables to get all your colors. In terms of the school interventions, we're going to be talking about nutrition policy and standards, Fitzroy. We have done work in school feeding. And then I am going to talk today about the classroom and community education with regards to curriculum review and HFLE. So we realized that the people knowing, children knowing is not enough, but it is necessary. As they say, necessary but not sufficient. You have to start with knowledge, and then after that you can talk about, you know, the other kind of factors and what you need to do and so on and so forth. So we wanted to enhance the knowledge and skills about NCD risk and drivers, so that children would have a better understanding of the environment that they are actually living in. And so when we looked at the curriculum at CXC and HFLE, Health and Family Life Education, which is run out of CARICOM, we realized that a lot of these curricula were developed over time, obviously. Started off with the whole sanitation thing, wash your hands after you go to the toilet, et cetera, and then came up through time into HIV, had a lot of input talking about sexuality and safe sex and so on. But up till now, there has not been a specific input around non-communicable diseases, and this has, NCDs has risen to the top of our priorities, so it was necessary to revise the curriculum. So we had started previously working with CXC, and so when the project started, one of the second, because you know, this project is a follow-on to a previous project that we had with Port of Spain, with, sorry, IDRC, where we evaluated the Port of Spain declaration, and out of that came some proposals, including the curriculum revision. So we worked with CXC and revised the curriculum on 2 subjects. And then with CARICOM, they are the HFLE people. So we also worked with them to revise the curriculum. We created a curriculum for the very early childhood, so the 4 to 6 year olds, because there was nothing there before, and then we revised the curriculum for the others. The revised curriculum was adopted by the CARICOM Ministers of Education in 2019. This is just a graphic showing you the 3 areas that we have been working in, CSEC, CCSLC, and HFLE. So just to give you an idea of some of the, let's see if I can minimize this so I can see, okay, good. Give you an idea of some of the revisions that were done. So for example, with CSEC, Human and Social Biology, they already have a curriculum. But what we did was that we added things like, you know, what are the hidden sources of salt and sugar? What are the benefits of fresh fruits and vegetables? What is the effect of sugar sweetened beverages? And of course, understanding the various forms of marketing. And as you may know, with CSEC and CCSLC, there is a section where the children have to do activities of their own. And so we propose for the children to create a social media campaign encouraging, you know, healthy eating, and develop a poster which demonstrates the amount of sugar in various foods. And this is, okay, I have to use this. Okay, this is the sort of thing that we are talking about as posters. So this is a graphic done by the Georgia Lane Chronic Disease Research Center, and it demonstrates the amount of sugar in the various products. And, you know, I think something as graphic as this really brings home the point. So for example, you see there in the middle, fruit punch by Pine Hill, right? And you would assume that it's a fruit juice and so it's healthy. But you see the package beside it, that's the actual amount of sugar in that small box of Pine Hill. So we think that this kind of graphic demonstration will be helpful for children to understand hidden sugars, for example, and what they're actually eating. So other things that we are asking in the new, that we have put in the new curriculum, determining your waist circumference, using BMI and waist circumference to categorize obesity, the prevalence and trends of childhood obesity in Caribbean countries, and then the activity would be like to conduct a graph and so on. Just to remind us what it is we are trying to teach, right? We are trying to teach children in particular that ultra-processed foods in red at the bottom should be eaten very seldom. And green at the top, the unprocessed and minimally processed, that should be your go-to regular food every day. Unfortunately, this has been flipped around and people are eating the ultra-processed foods every day, and the fresh foods are like a Sunday afternoon thing. That's not the way it needs to be. So that's where we're trying to go with informing children. CCSLC, we also had similar kinds of revisions so the children could understand about chronic diseases and their risks. So just wanted to share some photos with you of the process and the meetings that we had. This was a CCSLC panel meeting because, you know, they have their own process of revising curricula, and we just went in and strengthened and supported that process and participated as technical support in terms of what additional information needed to go in. So that was a group from CCSLC. In terms of CXC, the revised, the approvals, the revised syllabus was accepted by CXC subcommittee. And however, the CCSLC integrated science is undergoing review because they are reviewing the entire CCSLC. So ours got caught up in that. Everything is being revised. But CSEC, the human and social biology, was implemented by CXC in 16 countries in 2020 and will be examined in 2022. So we are encouraged to know that the additions and modifications we made to the curricula are actually going to be translated into the classroom. So when we talk about HFLE now, we remember that CXC only addresses secondary schools, and HFLE curriculum for primary schools needed to be updated. We engaged 2 consultants and involved CXC to make sure that we had a seamless transition between what children learn in primary school and then what they're going to learn in secondary school. So this was the HFLE steering committee meeting in January of 2019. This meeting set a very ambitious roadmap to get to ministers by November of that year, and we actually succeeded in doing that. So we are very pleased about that. We had UNICEF involved, Caribbean Development Bank, CARICOM, and then the countries themselves, and UWI, of course. So we created a new curriculum, I mentioned early childhood, and then we had a second draft. We had a steering committee reconvened. It went out to teachers, they made their comments, it came back, and then it was accepted in November. And this is the HFLE working group. Not sure if that's a repeat. Oh, these are the different working groups, right? So, and then we had representatives, of course, from across the region, in different countries across the region. So this was working group 2. I thought I saw 1. Ah, yes, working group 1. Kelly Williams, St. Vincent and the Grenadines is there on the far right, I think, of the first row or second right. You guys probably can recognize her. Okay. Right. So what we know is that HFLE is a fairly difficult subject to teach. Some teachers are uncomfortable with some aspects of it. There's a sexuality aspect. There's also, you know, we're talking about healthy eating, and we're asking teachers to teach something that maybe they themselves are not doing. And because it's not an examinable subject, then sometimes, you know, not as much attention is paid. So we decided that having revised the curriculum, we wanted to find children's voices that we could use to teach the children. So the children teaching the other children. So what we did with that is that we wanted to create like a Caribbean Sesame Street. So originally we had this great idea how we were going to do videos and so on, but time and budget means that we can't do the actual videos. But what we are going to do is create like radio, like some short radio or, you know, verbal scripts. So we had a story writing competition to get children from our 3 project countries involved in writing the scripts that we are going to use to do this work. Unfortunately, St. Vincent and the Grenadines was not able to participate because the Ministry of Health was very involved in handling the La Soufriere eruption. Then you had Hurricane Irma and you had your ongoing COVID spikes, and just capacity did not allow St. Vincent to participate. However, we got 85 entries initially from Jamaica, Barbados, and St. Kitts. And these were children between the age of 7 and 17 years. You look at the gender thing again, female 70, male 15. I'm just, throwing that out there so people can think on these things. The boys need a lot of attention. So what we did is that we had an initial short story, and then we picked 50 students, and they came in for a one-day training, October 16th, a Zoom workshop with theater professionals. So there's a group in Jamaica called Ashe, which is over 20 years old, which is a professional theater group. So they're going to help us in this process. On December 1st, we're expecting the final submissions, a 1,000-word long story with characters and plots, a skit. There will be 5 winners who get laptops, and the dramatic readings will be recorded and shared. So that's the kind of work we've been doing in terms of school curricula to educate children and try to address this epidemic that we have in the region. Thank you all very much.
Thank you very much, Professor Samuels, for a very informative presentation. Okay, at this time, we'll move to our second presentation, which would be done by Professor Fitzroy Henry.
Good morning, all, especially you, Wendy. Good morning to you as chairperson. Are you hearing me?
Yes, I am. Good
Wonderful,
morning.
Wonderful. I'm in Jamaica, but it's happy to be back in St. Vincent and the Grenadines. And I want to present a few slides on some work in progress in relation to school nutrition policy and standards. Professor Samuels just talked about several things that are ongoing in the schools, very interesting and exciting innovations, things that we don't do normally, but of course it will help the whole education process for students. And as you know, there is always the cruxing and vexing issue about school feeding programs and whether it is targeting the right students, whether it is doing what it's supposed to do. There are also a number of issues related to marketing towards schools and so on and so on, but it all has to fit into some sort of framework. And this is why we're trying to develop schools nutrition policy and standards which will guide the implementation process of various programs in St. Vincent and the Grenadines. So this food and nutrition policy is very much in keeping with the PAHO and CARFA approach, because they're developing for CARICOM policy and standards for schools. So we're working closely with them and in line with them with the work that is going on in different countries in the region. But before I go on, I just want to put a plug for some other things that we're doing in St. Vincent and the Grenadines. We talked about the ultra-processed foods just now. Professor Samuels mentioned them. Those ultra-processed foods didn't come from nowhere. A lot of it came from imports. And in one of the seminars and webinars that we will have in the new year, I'm going to provide some information on how much of the imports that we have in St. Vincent and the Grenadines actually comes from, how much of the imports really contribute to what we call health retarding circumstances and health promoting foods. So I think that you know, everything that redounds on our nutrition really comes from somewhere. And I will be presenting the analysis that we have done on that. I think that would be very interesting, and I hope that you will turn out and help to contribute and help us to understand the information that we are gleaning from the analysis. Another important project that the fund is doing is looking at some small grants, which I mentioned, I think, in the last time we had this webinar. And the projects are developing nicely. I see Dr. Tony is on the platform, and she is very much involved with one of the projects. And we also have the Eastern Caribbean Trading and Agriculture Organization, which is centered in St. Vincent and the Grenadines. And we have projects from Mesopotamia to Sanssouci. So I encourage you to join us so that we can look and see what is happening with the crops and the small ruminants and all of that, that we're trying to get women farmers in particular to develop. So I encourage you to join in that one as well. We also would be presenting some information on the ingredients that we see in our commonly consumed foods. How much trans fats are you eating in St. Vincent and the Grenadines? How much saturated fat? How much sugars and sodium? As you know, these are ingredients that are inimical to health, and we need to understand that. So these are other things that the FAN project is doing. I hope that as I gave that introduction, more persons from the Ministry of Education or teachers have joined so that we can get some interesting questions after my short presentation. As I said, this is a work in progress, and I want to just discuss a little bit what is the intent in terms of policies and standards for St. Vincent and the Grenadines. The objective is really to develop and implement nutrition standards and guidelines for food available in schools. Another objective is to promote and improve nutrition status of children in order to enhance and sustain the physical, social, mental well-being in children in St. Vincent and the Grenadines. We want to ensure that no child is hungry at school, so all students have equal opportunity to learn. And here, of course, we're going to include the school feeding program, among other initiatives that are going on, and put some sort of framework for the development of these types of programs. We want also to think about restricting the sale of certain foods, including sugar-sweetened beverages on and around school premises, and encourage more locally made products to be consumed. And then we want to make some measurable objectives in the number of schools that provide healthy dietary options, the number of schools which have implemented mandatory physical education and exercise. So those are some of the broad policies. In relation to the standards, we are looking at the scope of the standards, exactly where is it going to apply? Well, it would be in and around the school premises, the school compound and surrounding vendors, who it will be the canteens, the vendors, those contractors, concessionaires, teachers and students are also going to be involved in the development of the standards, and it will apply to them. Where the boundaries of the school environment, and we have to look specifically at the dimensions of those boundaries. Is it 1,000 yards? Is it 300 yards around the school premises and between the school hours? How are we going to figure out what is the boundaries for schools? So we depend very much on consultation with our colleagues in St. Vincent and the Grenadines to guide us in terms of what is feasible and what is practical. And of course, it will be during school hours and specified school events and activities. Will there be exemptions? For example, when we have a special day Are we going to relax those standards, or those standards will be maintained irrespective of when we have games day or sports day or any special promotional activities in school? So these are the things that we need to adjust to the local circumstances, and the input from our colleagues locally would be helpful in developing these standards so that they will be most realistic and practical. So what will these standards look like? There are three categories really. We are going to look at the cooked meals, and this is not a given, it's just an idea of what we would like to see in cooked meals, where the calories are going to be between 450 and 650. The protein between 6 and 14 grams, 39 grams of carbohydrates, 15 to 20 grams of fat, and vitamin C between 15 and 20 milligrams, and iron between 3 to 10. This is not the final, this is just a guide as to what the standard would look like. We're going to have discussions. As I said, it's a work in progress, so that we can narrow this down and get something more appropriate for you in this country. What about the non-meal snacks and foods served? Sodium less than 1 milligram per kilocalorie, free sugars less than 10% of total energy, total fat less than 30% of total energy, saturated fat less than 10% of total energy, trans fat, some may say none at all, some may say less than 1% of total energy. And here is where we can provide the technical background, but you will tell us exactly what you think is appropriate for St. Vincent and the Grenadines. And of course, we have to look at beverages. You know, some countries in the region have already restricted, some have actually banned the sale of certain beverages above a certain concentration around the school environment. So perhaps we will look at a gradual reduction from wherever and there's where the lab results would be very important, so we can see how much concentration of sugars, for example, in what is the concentration in 100 milliliter of a beverage, and do we go in a gradual way over 2 years or 3 years to reach the WHO recommended 2.5 grams per 100 mil. So it's a work in progress, and this is what the standards will look like. And hopefully these kinds of standards will put the environment in place for us to have healthy consumption of foods, and our nutrition and health hopefully will improve in short order if we adhere to them. So there are other standards that relate to the environment. We will also develop some guidelines for procurement and purchasing, whether it's the school feeding program or other programs. There are guidelines for how you receive the foods, how you store the foods, the ordering and issuing of contracts, and guidelines for the production and service of the meals, food safety guidelines, how do we keep the records for evaluation, and of course, guidelines on marketing, which Professor Samuels just mentioned is a big issue when it comes to the consumption of these unhealthy foods by school children. And just to elaborate a little bit on the marketing aspect, the marketing efforts which might be regulated include the promotion of product brands which are high in fat, sugar, and salt. How much regulation you think should be, and we don't need the participation of only the teachers and the education sector. Everybody on this call should be able to give a view on whether or not the marketing of these foods and the product brands should, how do we deal with them? Should there be restrictions? Should we allow the industry to come in and promote their brands, which of course will resonate with children long after that event is done? And this is what is causing a lot of the increased consumption of these health retarding foods with these high ingredients of fat. So I want your feedback on how we should really look at the marketing standards. And do you think the circumstances in St. Vincent and the Grenadines would allow for this kind of restriction of the marketing of brands? The sponsorship, again, the same type of thing of the brands high in salt, fat, and sugar at school events, at games, meetings, where they give you discounts for their fast foods and high sugar beverages. And of course, as I said, the students and the children, they just continue with that after the event. And the other activities which are considered philanthropic activities, they're tied to product brands, where they give away a lot of free stuff. But it's the whole aspect of marketing which really stays with students. It stays with all of us. We might not think it's affecting us, but of course, marketing is a very powerful force. And what is it we need to put in place in these policies and standards so that we can prevent our students in particular to be so highly exposed to them? So maybe I can get some feedback from you in terms of the level of restriction. Should they be banned? Should there be exceptions on certain days? This is the guidance that I hope to get feedback on. What we in the FAN project will do is we'll continue with these consultations, and we can consider this webinar a consultation. Towards the end of the project, we will certainly continue. We're going to support the development of the final draft policy and the standards. Remember, we are only guiding, but it's the local organizing committee that really is responsible for the development of this. But of course, PAHO and the CARFA, as I mentioned at the beginning. And if possible, we can help in the finalization of the submission, which will be made to Cabinet to have it all ratified and become, if you like, a legal document. So please help us in giving your feedback on these issues. That ends the presentation. Wendy?
Thank you very much, Professor. Thank you very much, Professor Henry. We now invite your comments and questions.
Let me, Wendy, I know we have a very important spokesperson out there. I see Gregory in the audience. Dr. Robin, what do you think we should be doing in the schools? I know you're an agriculture-based man, but you're a very worldly man and you have views on almost everything. If your microphone is functional, can you tell us what you think might be useful for us to include in terms of the branding, and how can we protect our students from this kind of marketing that currently goes on? Gregory? Gregory is never shy to talk.
First of all, I think I'm very impressed with the progress made by the project. I haven't been involved at COVID. I'm back home working from home. I'm doing consultancies. I'm very impressed with the motions and the advances made in the education end and the standardization that have been made on the branded products. My concern is the private sector, because they are the direct competitors to the success of the efforts that the project is making. And the private sector has to be a very important partner in quelling the branded products that are marketed free to the youth on cable television. So they've seen all that stuff on cable television and naturally they gravitate to it. So I think our efforts are commendable, but unless you quell the private sector importation of these processed foods and you really and truly have some good contact with it has to be a policy issue on the advertising on cable television. I mean, the kids sit all day, and COVID, we're at home now looking at television. And the children, some of them don't even know what a dashing plant looks like. You know, so I think we have some real issues with private sector importation, television marketing.
Do you think, Gregory, that there should be restrictions on children's programs like happens in other countries? Do you think that there should be a complete ban as happens in other jurisdictions? How far do you think St. Vincent and the Grenadines would be acceptable of a regulation? In specific terms, what you think would be, or is it just leaving it up to them to be discretionary about their marketing? What you think might be feasible for St. Vincent?
Let me just say to the audience that I did work as the cardio representative in St. Vincent for 6 years. So I know Wendy also pretty well. So it's not as if I'm talking about a situation that I don't know about. I think we should provide guidance to the policymakers. I think the policymakers in St. Vincent, those I know, starting from the Prime Minister, would be receptive to good, sound technical guidance. And that should come from the project led by Alafia and yourself. I think we need to do that. Otherwise, you have to remember, you know, that the private sector has the money to market and literally interfere with your program and the progress of your program. So I think you need policy support. You can't succeed without policy support.
Right. No, I agree with you completely. And that's why we're trying to develop this policy. What Alafia and myself can do is give the options out there and the number of options. And what I'm trying to get at is how severe those options can be. Should it be a voluntary thing to the private sector to say, look, this thing is affecting the health of our children. We are asking, if you like, begging you to cut down on the number of advertising, or should we say you can only advertise in non-children's programs, or should it be back? Is the level of policy that we should be, and that really can come from Professor Samuels or myself. That has to be really dependent on the local tolerance, if you like, for regulation. And I don't know, and this is why we have the local consultations to give feedback on what might be acceptable at this point in time for any kind of regulation. So I don't know if any other person in the audience has a view on this. To what extent should we go with these policies? We don't want to put a policy in place that is going to stay on the shelf. We want a policy that can work and moving towards a goal. We might say, look, restrict the marketing, for example, for like in America, you can do it for so many hours on weekdays and so many hours on Saturdays and all of that. It's very complicated how the marketing works in the United States. We don't know what the situation is, and that's the feedback. I don't know if anybody has any views on this. Yes.
Let me make some suggestions. Cigarettes are no longer, cigarette companies are no longer big sponsors in major sporting events.
Right.
And similarly is alcohol. We got to take a cue from that. This thing is about money. It's about profits. It's not about sentiment and voluntarism. So if I'm selling Coke, which is a worldwide product, highly marketed, there has to be some kind of containment. So for sexual programs on television, there's all kind of checks and balances to prevent children from looking at sexual programs. We got to learn from these methods and implement it in the same way with policy support. You can't depend on the companies, private companies, to be emotional, sentimental, and try to cut down the profits for health reasons. It hasn't worked. I think we need a good policy support. And what it is, I notice you have some support from the World Health Organization, has made some pronouncements which you're following. I think with the advancement of COVID and the importance of international institutions, if they lay the groundwork in terms of standards and they get in some effect, then you should tag on to that.
Okay.
Yes, this is Alafia. Sorry, I'm the Grinch who stole Christmas, but I just really have to give us a reality check. I agree totally with the ambition to restrict marketing. The reality, however, is that most of the media that we consume in the Caribbean is created outside the Caribbean. People are not watching TV Jamaica or the local Barbados TV station or whichever country. Even those stations import content and advertisements from the North America. Also, everybody is on cable and the cable comes from either South America or North America, and there's nothing that we can do in the Caribbean to stop that. That's the reality of us in the Caribbean. The second point I wanted to make in terms of the marketing of, well, the marketing we talk about in that context. So yes, let us be clear that the marketing, I'm not sure if we're going to be able to stop the marketing. So, you know,
it really, you know, Alafia, it really depends on the gumption of the policymakers, because there are restrictions in countries even of marketing on Facebook and social media, and it's implemented, right? If they have the gumption to do it. Look what China did with, I don't know if you're following the news with the Chinese with this tennis star. They have blocked CNN completely out of China, any mention that is made of this tennis star. So it can be done depending on the political importance of it.
Let's be realistic. We do not have any politicians in the region of the Caribbean that have that amount of gumption.
Yes. And this is why I was asking for for our colleagues in St. Vincent to talk about what is the tolerance level in St. Vincent for any type of restriction at all, right? Because we have to, apart from, you know, how powerful they are, remember that they are very, very important parts of the economy as well. And because we are very small countries, they tend to dominate our space and even the policy making avenues that we have. So it's a question of what we know, the science, we know what these sugar sweetened beverages are doing to children and so on, but we're not going to get policy on implemented unless it is, you know, feasible and practical, and I dare say politically expedient. So, you know, this is why the consultations locally, because what is applied in St. Vincent is not necessarily what will be applied in St. Kitts or in Dominica or in Jamaica. It really depends on, because we really can't have a blueprint. We have some core things which are immutable. You know, we're not going to compromise on certain things. But the extent to which we want to do any kinds of regulations or restrictions will depend on the amount of, for abuse of a better word, tolerance, if you like, of any restrictive activities. Some countries are much more, I mean, look, we have 2 countries in the Caribbean that put a tax on sugar sweetened beverages, right? They are willing to do that. Not many others have done that or even willing to do that at this moment. You know, that's the kind of thing in Barbados and in Dominica. They were willing to do that. So it's not a blueprint.
Don't forget Bermuda, 75% tax.
That's right, Bermuda. Bermuda also did that. So you see, it really depends on, you know, which country we're dealing with. And the consultations really will help us in determining something which is really practical and workable. Whether we have to talk to the senior policymakers, whether we have to talk to the prime ministers, whether we have to talk to whoever, so that what we put down in the document is something that will make sense and can move forward.
Yes, Fitzroy, that's very important because, you know, the policymakers often look at us as academic people in the ivory tower who are just talking theory and don't know anything about real life. So I think it's very important for us when we are talking to the policymakers for them to understand that we do understand what is real life. And for example, when there's a cabinet meeting, right? The Minister of Health is one of 10, 12, whatever cabinet members, and the cabinet makes a decision together. So when you're talking about things like restricting trade or banning this or banning that, the Minister of Trade and the Minister of Finance probably have bigger talk than the Minister of Health, even though we're talking about health.
Absolutely. I mean, just look at front of package labeling and what
There you
has
go.
you have a difference of opinion within the cabinet. It's not a holistic group. It's not a homogeneous group. They have different interests, different drivers, and we can
Different
only
constituencies.
absolutely, absolutely. So
Hi, everyone. We have one hand raised for quite some time, so I'll allow that person to speak for now.
please.
Thank you.
Hi, good morning.
Morning.
Yes, I'm Mrs. Vicky Job Millington, and I'm the school feeding coordinator. I just need some clarity concerning the final role of the project. So we are speaking about the development of the policies and standards. And Mr. Henry, in your presentation, you spoke about the target groups that will benefit from the policy and standards. You mentioned that the policy will be brought to the attention of cabinet. So the clarity that I need is concerning the sensitization and the implementation of the policies and standards. Will the project be assisted in this or providing support or playing any role in terms of the implementation process? Because I see with this, the lead ministries will be education, of course, and also Ministry of Health. So the role of the project, would it just be to develop the standards, or would we be receiving assistance in terms of the implementation process as well?
Well, we have to look at the timeline of, thank you for that intervention. We have to look at the timeline of the project. My understanding is that this will not be completed before, let's say, February. I'm talking about the documentation next year. And it will, and correct me if I'm wrong, it needs to go to cabinet before it can be ratified and used and even implemented. So by the time we come around to implementation time, the project will be over, because we're not going to be doing too many activities after, we can't be doing too many activities after May or June. If, however, we are needed anytime before the project is completed, as I said, we are hoping to even help take it to the cabinet. In the implementation phase, and it is clearly, if we can support, definitely, we will be able to support any form of implementation that is required. And because of the experience we have in these kinds of projects, even if you're not ready for implementation, we can give you some lessons learned from other jurisdictions where they have attempted to implement and provide some guide rails for you in terms of implementation. So it's a question of time. The FAN project is here really to assist you. So, you know, whatever is needed within the time frame that we have, we will certainly try to assist.
Okay, thank you. I have another question.
Yes.
I know that the nutrition unit has a draft school nutrition policy and a draft child nutrition policy. So were these policies looked at, or will they be looked at and play a role in the development of this policy?
Yes, it will be congruent. We don't want policies talking against each other, talking across purposes, because all the existing policies, and PAHO and CARFA they have done a good job in looking at the related policies and looking at where the core policy for the region is and trying to merge these so that you wouldn't find in the school nutrition policy something that goes against or talking in cross purposes with the food and nutrition policy as such. And that's the process that we use in every country. So I'm sure that the local committee will be looking, and they have looked at the related policies and make sure that there's congruence among all of them. Yes.
Okay, thank you.
You are most welcome. Any other? Wendy?
I think there's a comment in the chat from Audrey Walters. And she's saying, in terms of marketing, I think our local foods should be market/advertised equally. We should stress strongly, eat what we grow and grow what we eat. The government signed to so much treaty and CARICOM issues, hence will not tighten the importation of goods.
Right. I mean, I certainly agree. The question is, do we have the financial backing to do the marketing of the local foods? You know, the pocket of the food industry is very deep because their bottom line is profit. And they will spend almost any amount of resources to get people hooked on their either fast foods or sugar sweetened beverages. If we had a similar deep pocket for our local foods, which are more nutritious, which are more tasty if prepared properly, and so on, then I'm sure that we will start. But the big challenge, as I see it, is the resources to do the local marketing. And that's why we have to depend on these policies and guidelines and standards, because we don't really have the resources to market or even market the local foods, even though that is desirable. I don't know if she has any suggestions of how we will find the resources to market our local foods, apart from, you know, what we already know from tradition and culture that we use. But as I said, these things are now dominated by the imports and dominated by the marketing agencies out there for these companies. And we, in a sense, we are at a disadvantage. And I repeat, that the leverage that we have is through these policies and standards, because we can. And most of, well, I don't know what the media is like in St. Vincent and the Grenadines, but I can tell you, long ago, we used to have these free spots that were given for social programs and health programs on our media. Now, regardless if it's something that is as noble as the health of children, you still have to pay the media, the mainstream media, to get anything out there, and that costs money. I can tell you that in Jamaica, the Heart Foundation had a wonderful campaign in talking about the dangers of sugar-sweetened beverages. Some of you in St. Vincent might have heard about it, or but it was quite expensive, and it was not affordable by. It wasn't certainly affordable by the government. It was an external entity that actually provided millions and millions, and it made the local manufacturers cower in a corner because of the information that they were able to provide against these sugar-sweetened beverages. So if we have those kinds of resources, we can certainly market the local foods that we have in St. Vincent and the Grenadines, but it is a question of finance, and unfortunately, that's almost everything now boils down to finance. I don't know if she has any comments, the questioner. about how we'll be able to do that marketing with the limited budget. Maybe Wendy or Nicole can tell us about if there's a marketing budget in the Ministry of Health Nutrition office that can market the local foods to compare with the marketing we see in social media and in the mainstream media. Over.
Well, I believe the nutritionist is on the chat here, so maybe she can answer and you can find out from her if there is a budget in the ministry for marketing.
That's Nicole, right?
Yes.
Good morning, Professor Henry. Good morning. Are you hearing?
Good morning. Yes, please.
Okay, I didn't realize I was unmuted. No, there is no budget. What we usually do, like you said, we use the free spots on some of the radio stations, television, to do things like that, but there's no fixed budget for that. But we should work on it in the future.
Yes, I'm sure you're doing that, but in relation to the big picture about the question that was asked, you know, is it going to be at a level to compare with what the industry is, what the industry is I was just reading the chat, sorry. What the industry is putting out there, it's a major challenge.
It is, and I doubt we'll be able to match it. Professor Henry,
yes,
can I respond to something that Alafia,
yes,
to
please,
her presentation? In terms of the curriculum, we have updated our food-based dietary guidelines, and what we did, we worked with HFLE teachers. We got them to actually put into the curriculum lesson plans and other ideas to help them get the message across to teach the food-based dietary guidelines. So we are going to get the message across through HFLE. So that was one thing that we did on our part. We worked with Ministry of Education, worked with curriculum unit, and we got our foot in the door. Let me put it that way then, when it comes to the food-based dietary guidelines. So as one step on our part. I don't know if Vicklin would have anything else to add to that. We're also helping with the school feeding program. We have revised our menus. We have put out recipes there. We're trying to use local foods, but I think we're heading in the right direction. But one thing, Professor Henry, one of our major stumbling blocks is front of package labeling, which you mentioned already. That's something that we want to push for, to educate basically, so that children's parents can make the right choice. But just like Jamaica, we're coming up, we're coming up against roadblocks. Industry. Thank you very much. Right. So we want to see it, but it's just not happening for us. And then that would help us with the school environment in and outside, because if children can see, they can read for themselves, they will make wise choices. But your input will be greatly appreciated.
The fight is not over. We had a defeating battle, but we are blooded but unbowed. We will. It is so important. It is so important. It is also a kind of equity issue, because if you are well educated with a university degree, you can read the back of package and understand what it's saying. But that back of package is not something that the normal person can even understand.
Correct.
And so this is discrimination in information. It's a human rights issue.
And that is how we explained it to Bureau of Standards here, that yes, the information is there on the back, but not everyone can read and understand what is there. So on the front that everybody sees, just give them an indication, high in this, high in that. But just like Jamaica, I guess we got knocked down, but we're not going to give up. It's important though.
Yeah, it's a tough road, people. And let me tell you, one of the big differences I always point out between non-communicable diseases and communicable diseases. Right now, we have a COVID pandemic. There is no constituency that is defending COVID. There's no constituency in the world that says COVID is a good thing, we should spread it more. But compare that with NCDs, where we know, for example, that sugar and fat and so on, there are billions of dollars behind sugar and fat to say, add more, eat more, come on people, if you want to be fashionable, this is what you need to do. So the opposition in non-communicable diseases is tremendous. I explained to people why we will never get the kind of money that HIV got. Because HIV got a lot of money because the people in the first world, in the high-income countries, knew that, you know, with international travel, their population would be exposed if we in the Caribbean, for example, had an explosion of HIV, right? But if we have a lot of diabetes in the Caribbean, the only thing it does is make more profit for the American companies. There's nobody interested in stopping our epidemic here but us. And that's why we have to go the route of taxation and regulations, because we cannot compete with marketing. We cannot compete with marketing. They have billions of dollars. They employ psychologists to decide what color they should make their product to make you buy it. We can't compete with that. We have to tax them and we have to regulate them. That's it. And that takes political, let me find the right word. I don't want to say the wrong word. It takes political, you know, grit. And the trade and finance ministries are more powerful than the health ministries in the Caribbean right now. So we're batting on a very sticky wicket. I don't want to depress us, but I just want us to be realistic, you know, as to what we're facing.
Do we have any more questions?
Did you see the comment in the chat from Ronel?
Yes, I'm seeing it now. Okay, so it's saying, good morning, everyone. I don't think enough emphasis is placed in the field of marketing in any aspects in St. Vincent, whether it's agriculture, tourism. We need to educate our locals first before looking regionally and beyond. There's also another comment from Sylvan Jack. She's saying it is important to have standards to ensure that healthy foods are available in schools. What measures would be put in place to ensure that there is sufficient quantity of foods available?
Can I just make a comment on that?
Go right ahead.
Yes, the quantity of food will depend on local production, and that's for the agriculture sector, to ensure that that is available. And if it is not, as you know, the Caribbean countries and St. Vincent and the Grenadines in particular is a net food importer, right? We have to import foods to meet the demands of our population, even our children and schools and so on. So the local production, we're going to try to increase that as much as possible to make sure that is available. And of course, we have to supplement that, or complement that, I should say, with imports. The thing about the policy and the standards, what we need to do is to put the guidelines in place. That's why they are there. So that whether it is coming from local or imports, we make sure that what children put into their mouths is something which is nutritious and healthy. So we have to make sure that it's available, as you're saying in the chat question or comment, yes, and that will come from different sources. But what this policy and standards are doing, they are trying to make sure that whatever we have in the school environment is wholesome in terms of improving health.
Okay, do we have any questions at this time? If not, we're going to wrap up. Okay, we want to thank everyone for coming and contributing. There is a short survey which will be sent after the webinar. We would like you to fill out the feedback for the webinar. This was our second webinar, and we will be having upcoming webinars, as you would see on the slide. Projects and Intervention Part 1 in early 2022. Women Farmers Academy for ingredients analysis, sugar, salt, and trans fats results. And we would also have another webinar, the final webinar, and projects and interventions, part 2, in early to mid 2020 on small grants project, nutrition trends, production, imports. We want to thank you for being with us today. This is where we end our webinar.